Sanford AirMed has served the Midwest region for more than 35 years. We are proud to serve with 3 EC-145 helicopters, 1 Bell 230 helicopter, and 4 King Air B-200 fixed-wing aircraft. With bases in Sioux Falls, Fargo, Bemidji, and Bismarck, Sanford AirMed can transport patients anywhere in the lower 48 states, Alaska, and Canada. Sanford AirMed is a flying intensive care unit. The program is different from others because our staff is made up of highly trained critical care nurses and paramedics who can deliver life-saving care to patients immediately upon our arrival. All Sanford teams are licensed to provide critical care services. Some of these critical care services include advanced management of the airway, administration of blood and blood products, care for patients with balloon pumps, and insertion of chest tubes to reinflate collapsed lungs. Life-saving equipment available on every flight includes heart and vital signs monitors, defibrillators and pacemakers, invasive line monitoring equipment, lab analyzers, ventilators, infusion pumps, pulse oximeters, and advanced life-saving medications. The care provided by Sanford AirMed transport teams is dictated by protocols established by the medical directors. In addition to these protocols, medical directors are responsible for ensuring competency of the flight staff and reviewing flights for appropriate care. This quality improvement process is key to the quality of care provided by Sanford. Medical directors include emergency medical physicians, a chief trauma surgeon, pediatric intensivists, neonatal intensivists, and others. Often they are the receiving physicians for the patients being transported. All aircraft are dispatched from a centralized communication center where dispatchers use the latest in technology and are responsible for the coordination of transporting the patients and team to their final destination. They are committed to make the transport safe and efficient for every patient. Sanford AirMed mechanics have extensive experience from both civilian and military backgrounds. Mechanics attend factory schools and do a tremendous job maintaining AirMed aircraft to the highest of standards. Sanford AirMed employs its own staff of experienced pilots. All pilots attend annual simulator training at factory-approved schools, as well as semi-annual company training and check rides. A variety of aircraft communication systems and satellite phones allow transport teams to be in constant contact with specialty physicians. Patients are transported to the medically appropriate facility of their choice. All Sanford AirMed aircraft are outfitted with the latest in safety technology devices. Sanford's helicopters are new from the factory. 4 pilots and 2 mechanics staff each aircraft base. Our pilots fly twin-engine helicopters that feature a large, open cabin. This allows staff ample space to provide patient care during the flight. Other unique features of the helicopter include night vision goggles, a 30-second start and shutdown, and rear loading for crew and patient safety. The helicopter's maximum speed is 167 miles per hour with a maximum range of 425 miles. Our fixed-wing aircraft, the Beechcraft King Air 200, is available 24 hours a day, 7 days a week, 365 days a year. This aircraft is operated with a pilot and co-pilot. It can hold 2 to 5 critical care attendants and up to 2 patients during a flight. The cabin features LifePort custom interiors. Its average speed is 300 miles per hour, with a range of 1,500 miles. It has short runway capabilities, which allows the aircraft to land and take off in more locations, allowing us to transport patients in the most efficient way possible. Sanford AirMed is composed of 4 specialized flight teams. They include adult, neonatal, high-risk OB, and pediatric. The teams have advanced training in cardiac, trauma, burns, pediatrics, OB, and neonatal critical care. All teams transport in the helicopter and fixed-wing aircraft. The adult team consists of registered flight nurses with a minimum of 3 years critical care experience and flight paramedics with extensive experience in the care of critically ill and injured patients. They transport patients between interfacility hospitals or directly from the scene of an accident. Our neonatal team transports critically ill newborns with a combination of certified nurse practitioners, neonatal intensive care nurses, respiratory therapists, and paramedics. The intensive care nursery team works in the neonatal intensive care unit and is directed on transport by the neonatologist. The OB team is composed of a high-risk OB nurse, adult nurse, and paramedic. A combination intensive care nursery and OB team is often utilized to care for mothers and baby if delivery is imminent. A perinatologist with experience in high-risk pregnancies directs the team. The pediatric team is composed of highly experienced pediatric nurses, adult nurses, and paramedics. A pediatric intensivist directs the pediatric flight team on all medical transports. The respiratory therapists are a unique part of the transport team because their duties can be quite diverse, depending on the patient's needs. The transport therapists are an asset to the team with responsibilities ranging from patient assessment and respiratory drug delivery to airway management, mechanical ventilation, and tidal CO2 monitoring, balloon pump, and oxygen therapy. Safety is the foundation of Sanford AirMed. AirMed is dedicated to creating, implementing, maintaining, and constantly improving strategies and processes in its air medical activities. AirMed is committed to fostering a safety culture in which all team members are engaged in the practice and promotion of quality, accountability, and safety. Our success is influenced by the philosophy, every patient, every flight, every time, safety first. Sanford AirMed offers a membership program that helps keep the cost of healthcare down. This transport membership program helps by covering out-of-pocket expenses that occur with medically necessary air medical transport. The membership program will directly bill the patient's insurance company and will cover any amount they do not pay. If the patient doesn't have insurance, this program will cover the entire cost of the medically necessary flight. Sanford AirMed is dedicated to the work of health and healing. We are leaders in air medical transport and strive to provide patients across the region with convenient access to expert medical care, leading-edge technologies, and world-class facilities. Sanford AirMed, there when you need us.